60 seconds can save an entire lifetime. Picture this. You're sitting on the couch watching your favorite TV show. Just another peaceful evening. Then suddenly, something tightens in your chest. Your breathing gets heavy. Your left arm tingles, and sweat starts to pour down your face. You try to stand, but your legs tremble. No one's around. No one can hear you. In that moment, you realize your heart is sending a warning. Every year, more than 380,000 Americans over 60 find themselves in the same situation, having a heart attack while completely alone. Many don't survive the first minute not because the pain is too strong, but because they don't know what to do. They panic, freeze, or wait for help that comes too late. But here's the good news. Researchers at the European Heart Journal discovered that seniors who know exactly what to do within the first 60 seconds increase their survival rate by up to 73%. 60 seconds, it sounds short, yet it can save an entire life, a family, a future. If you're in your 60 seconds, 70 seconds, or beyond, you are not weak. Your body still holds incredible power when you know how to guide it. In this video, we'll go through 7 life-saving techniques verified by doctors from Harvard, the Mayo Clinic, and Johns Hopkins methods, simple enough for anyone to do, but powerful enough to change the outcome between life and death. And remember this, you're not surviving just for yourself. You're surviving to watch your grandkids graduate, to walk hand in hand with your partner on quiet mornings. 1 minute of calm, one right action can keep all of that within reach. The untold truth why many don't survive the first minute. When a heart attack begins, everything happens faster than you think. Within 15 seconds, your brain starts running low on oxygen. You feel dizzy, your heartbeat becomes erratic, and just moments later, everything starts to fade. It's not because you're weak, it's your body's natural survival response. Ironically, that very instinct is what causes so many people to lose their chance at survival. 89% of adults over 60 admit they wouldn't know what to do if a heart attack struck while they were alone. Some try to lie down and rest. Others attempt to stand up, look for medicine, or call a loved one. But in the middle of oxygen deprivation, the brain can no longer think clearly enough to give the right commands. One wrong move, lying in the wrong position, forgetting to unlock the door, or not dialing 911 can make all rescue efforts come too late. Cardiologists call this the golden minute, the first 60 seconds that determine up to 70% of your survival chance. The good news is, you don't need to be a doctor or a medical professional to use that time wisely. You just need to be prepared. The survivors aren't always the strongest ones. They're the ones who stay calm and know what to do. Just like putting on a life jacket before setting sail, you can prepare 7 survival habits that protect you when your heart sends out a distress signal. Each habit is simple on its own, but together they form a powerful shield that can carry you through the crisis even when no one's there to help. In the next few minutes, we'll go step by step through every action you can start practicing today. Because the truth is, heart attacks don't give warnings, but the choices you make today could be the reason you're still here tomorrow. Survival habit number 7. Set up your lifeline before you ever need it. No one wants to picture themselves having a heart attack alone. But the truth is, being prepared doesn't make you weak, it makes you safe. When a heart attack strikes, your brain can start running low on oxygen within seconds. In that state, remembering a phone number, recalling your address, or even finding where your phone fell can become nearly impossible. That's why preparation has to happen while you're healthy. Start by writing your full address, phone number, and any door or gate codes on a brightly colored sheet of paper and tape it next to every phone in your home. When your mind is foggy, your eyes can still recognize what's in front of you. Set the 1 key or SOS button on your phone as a direct dial to 911. You might think you'll remember, but in a moment of panic, one simple button could save your life. Always keep your phone within reach, especially at night. Nearly 43% of heart attacks in older adults happen between 10 p.m. and 6 a.m., when phones are often charging in another room. Keep it on your bedside table, within arm's reach, so you can grab it even in the dark. If you live alone, consider wearing a medical alert device or an emergency wristband. Choose a waterproof model, because 1 in 3 heart attacks occurs while bathing or washing up. Don't take it off when you sleep. A single press can instantly alert emergency responders. And finally, don't hesitate to tell your neighbors or building manager about your health condition. Give a trusted neighbor a spare key, or at least your emergency contact information. One person who knows you might need help is worth more than 10 who have no idea you're in trouble. Preparation isn't pessimism, it's peace of mind. When your heart skips a beat, every second counts. And sometimes, a single sticky note or one small button can be the very thing that keeps you alive. Survival habit number 6. Cough CPR, the breath that keeps you alive. It might sound strange, but a single, well-timed cough can help your heart keep pumping for up to 90 extra seconds. Doctors call this technique cough CPR. And while it's not a replacement for medical care, it can buy you enough time to call 911 or wait for help to arrive. When your heart rhythm becomes irregular, blood stops flowing evenly to your brain. That's when you feel dizzy, your vision darkens, and you're seconds away from passing out. Instead of panicking, remember this simple rule: deep breath, hard cough, repeat. First, inhale deeply through your nose, filling your lungs completely. Then cough forcefully from your diaphragm, as if you're trying to clear something stuck deep in your chest. This isn't a light throat cough, it's a strong, deep one that engages your whole chest. Keep repeating the cycle steadily. Deep breath, hard cough. Deep breath, hard cough, about once every 2 seconds. Each cough acts like a natural chest compression. The deep breath brings oxygen into your lungs, and the forceful cough pushes blood out of the heart, helping maintain circulation while your heartbeat is unstable. According to a study from Peking Union Medical College, people who performed this correctly during a heart attack stayed conscious, an average of 90 seconds longer than those who didn't. But there's one crucial thing to remember. Only use this technique if you are still conscious and able to breathe normally. It's not for severe heart attacks that cause you to lose consciousness or struggle for air. And most importantly, never cough without calling 911 first. Practicing cough CPR is simple. Try it a few times a week. Take a deep breath, cough hard, and feel your diaphragm engage. Each practice session reinforces this life-saving reflex in your body. In the middle of a crisis, you don't need to recall dozens of medical steps. You just need to remember one breath and one cough, and that might be enough to keep your heart beating. Survival habit number 5. Chew the aspirin. Save your heart twice as fast. Most people know that aspirin can save a life during a heart attack, but few realize that how you take it can mean the difference between life and death. When a heart attack begins, blood inside your coronary arteries starts to stick together, forming clots that block blood flow. Aspirin works as an antiplatelet agent. It makes your blood less sticky, helping vessels open faster. But if you swallow the pill whole, it can take up to 25 minutes to dissolve. If you chew it, the medicine starts absorbing through the lining of your mouth in just 3 minutes. Think about that. Between those two choices, you could save over 12 minutes, and for your heart, 12 minutes can mean a lifetime. When you feel the first signs of a heart attack, chest pressure, tingling arm, cold sweat, sit down immediately and grab your aspirin. Choose the 325 milligrams tablet or 481 milligrams baby aspirins. Chew them slowly and swallow once they've dissolved. Don't wait for water, don't swallow the pill whole. That bitter taste means the medicine is already entering your bloodstream. Keep aspirin in the easiest places to reach by your bed, in your wallet, in the living room, and in your car. Store it in a small case and check the expiration date every 6 months. You don't need a lot, just one pill at the right time can make all the difference. And here's something crucial. Even if you already take a daily aspirin, chew another full dose during a heart attack. The low dose 81 milligrams you take in the morning is for prevention, not rescue. In an emergency, you need the stronger dose to stop the clot from growing. If you're allergic to aspirin or already on blood thinners, talk to your doctor about a safe backup plan. But if you can take it safely, make it a habit to check your aspirin supply every month. You'll never know when your heart might need it. One small pill, one quick action. Sometimes, that's the line between heartbreak and one more chance to hold the people you love. Survival habit number 4, the life-saving position. When a heart attack strikes, most people instinctively lie down. But that simple act of resting can actually make things worse. Cardiologists call it the deadly wrong position because it forces the heart to work harder at the very moment it's running out of strength. The fix is surprisingly simple. Sit up. Specifically, sit at about a 45-degree angle, leaning slightly forward with your back supported by a wall or sturdy chair. Keep your knees bent and both feet flat on the floor. This is known as the semi-Fowler position. It helps blood flow more easily, reduces strain on your heart, and allows your lungs to expand so you can breathe deeper. Think of your heart as a pump that's starting to weaken. When you sit correctly, gravity helps the blood return to your heart, easing its workload. A study from Tokyo Medical University found that patients who maintained this position during a heart attack had 35% higher oxygen levels compared to those lying flat on their backs. If you start to feel lightheaded or like you might faint, don't let yourself collapse. Lower yourself gently to the floor, lie on your right side, and bend your left knee. This is the recovery position recommended by emergency medical teams. It keeps your airway open and prevents choking if you vomit. Next, loosen tight clothing, unbuckle your belt, unbutton your collar, remove scarves or anything restricting your chest. Tight clothing makes the heart pump harder for oxygen. If the room is warm, open a window or turn on a fan. A cooler environment helps stabilize your heart rate. Remember, the right position isn't surrender, it's strategy. When your heart is struggling, help it by making its job as easy as possible. And once you've calmed your breathing and settled into the proper position, that's the moment your body starts to regain control. Survival habit number 3, slow breathing to let your heart rest. When a heart attack strikes, the first mistake most people make is they start to breathe too fast. Panic takes over, the lungs tighten, and the heart races to make up for the sudden oxygen shortage. The result? The situation worsens, but there's a simple way to reverse it: control your breath. Doctors call this the controlled slow breathing technique, often referred to as the 4-4-6 method. It not only calms your mind, but also gives your heart an immediate break. Here's how it works. Inhale through your nose for 4 seconds, letting your belly rise, not your chest. Hold your breath for 4 seconds, allowing oxygen to spread through your body. Exhale slowly through your mouth for 6 seconds, as if gently blowing out a candle. When you do this, your parasympathetic nervous system, the part that controls your rest and recover response, kicks in. It tells your heart, slow down, you're safe. A study from Stanford University found that after just 2 minutes of this technique, heart rate can drop by 10 to 15 beats per minute, blood pressure lowers, and oxygen levels in the blood rise significantly. If you find it hard to focus, place one hand on your chest and the other on your abdomen. The hand on your belly should move more. That's how you know you're breathing correctly. Belly breathing allows your lungs to expand fully, reducing pressure on the heart. There's another hidden benefit. Slow breathing helps prevent coronary artery spasms, one of the key reasons chest pain can intensify during a heart attack. Practice this habit daily while watching TV, before bed, or anytime you feel anxious. Because when the real emergency comes, your body will react exactly as it's been trained. Breathe in, hold, breathe out slowly. It may seem small, but every steady breath is your way of telling your heart, stay calm, I've got you. Survival habit number 2. Unlock the door and send a lifeline signal. This may be the simplest habit on the list, yet it's the one that has cost thousands of people their chance to survive. Picture this. You've called 911, the ambulance is on its way, but when they arrive, the door is locked, the lights are off, and no one responds. The crew has to break in or search for someone with a key. In those few lost minutes, your heart could stop beating. A study of 8,500 cardiac emergencies found that just a 10-minute delay due to a locked door reduced survival chances by 30–40%. That's why, when you feel the first sign of chest pain, your first move isn't to lie down, it's to unlock the door. Stand up slowly, lean on a wall if you need to, and make your way to the main entrance. Unlock it or leave it slightly ajar so paramedics can get in. If you live in an apartment, call the front desk or building security and tell them you've called 911 so they can guide emergency responders directly to you. Once the door is open, turn on all the lights in your home. From the outside, a brightly lit house helps the rescue team spot your address faster among dark homes on the street. If it's daytime, hang something brightly colored, a towel, a shirt, or even a piece of fabric from the door or window. It's a simple but powerful emergency signal. Another critical step, prepare a medical information sheet. Tape it behind the front door or on the wall near the entryway. Include your full name, date of birth, a list of medications, any heart conditions or allergies, and an emergency contact number. When the EMTs walk in, they'll have the details they need instantly, no questions, no delays. If possible, install a lockbox outside your home with a spare key inside. Register the code with your local fire department or emergency services. In many U.S. communities, they'll store it in their system, so responders can access your home within seconds. Don't wait until an emergency to think about this. An unlocked door can mean the difference between a timely rescue and a silent tragedy. Open the door, turn on the lights, let the world know you need help, because sometimes that one simple act is the first and last thing that saves your life. Survival habit number 1, nitroglycerin, the 3-minute lifeline. If your doctor has prescribed nitroglycerin, think of it as your heart's most loyal companion. This tiny pill can relax and widen blood vessels almost instantly, easing pressure on the heart and restoring blood flow to the oxygen-starved muscle. But it can only save your life if you know how and when to use it correctly. When you feel the first signs of chest pain, heaviness, tightness, or burning that radiates to your left arm, neck, or jaw, sit down immediately. Do not stand or walk. When your heart is struggling, standing can cause your blood pressure to plummet before the medication even has a chance to work. Once seated, place 1 nitroglycerin tablet under your tongue. Do not swallow or chew it. Let it dissolve completely for about 20-30 seconds. A mild tingling or slight headache is normal. That means the medicine is working, widening your arteries and helping your heart receive oxygen again. Set a timer for 5 minutes. If the pain doesn't ease after 5 minutes, take a second tablet. If it still doesn't improve, take a third after another 5 minutes. Never take more than 3 tablets within 15 minutes. And if the pain continues or you start to feel faint after the second dose, call 911 immediately if you haven't already. Here's a crucial tip. Chew an aspirin before taking nitroglycerin. The combination of aspirin, to prevent clot formation, and nitroglycerin, to open blood vessels, has been shown by Johns Hopkins researchers to increase survival chances by 58%. Proper storage is another life or death detail many people overlook. Nitroglycerin is extremely sensitive to light, heat, and air. Keep it in the original brown glass bottle, never transfer it to another container, and replace it every 6 months after opening. A good tablet will cause a slight burning or headache sensation when it dissolves. If you don't feel that, the medication has likely lost its strength. And remember, never use nitroglycerin within 24-48 hours of taking erectile dysfunction medications such as Viagra or Levitra. Combining them can cause a dangerous drop in blood pressure. Keep your bottle where it's always within reach on your nightstand, in your shirt, pocket, wallet, or car. Write the date you opened it on the label. Don't wait for an emergency to look for it. Nitroglycerin isn't magic, but in the hands of someone who knows how to use it, it can be the golden 3 minutes that save your life. One small pill, one right action. Sometimes that's all it takes for your heart to keep beating, to keep loving, and to keep living. Live proactively, not in fear. Now you know the 7 survival habits, small actions powerful enough to save your life when your heart goes into crisis. Each habit is a piece of a bigger picture. Keeping your phone and alert system ready, knowing how to perform cough CPR, chewing aspirin at the right moment, sitting in the proper position, breathing slowly, unlocking your door for rescuers, and using nitroglycerin safely. These simple steps, when combined, can help you survive the critical 8-12 minutes before emergency responders arrive. But above all, what matters most is your mindset. Living healthy isn't about running from illness, it's about understanding your body and protecting it proactively. Everyone over 60 can do this. You don't need an emergency room or fancy equipment, just preparation, awareness, and calm. Practice these techniques as part of your daily routine. Take slow, mindful breaths while watching TV. Check your aspirin and nitroglycerin supply each month. Keep your medical information sheet taped by the door. And most importantly, remind your partner or neighbor to do the same. You can't choose when your heart acts up, but you can choose how you respond. Preparing today isn't about fear, it's about love. Love for the mornings you wake up to sunlight, for a warm cup of tea, for your grandchildren's laughter, and for the freedom of doing things on your own. So don't let fear replace your confidence. Every breath you take is a reminder that your body is listening and your heart is still ready to move forward with you. Share this video with the people you care about, your parents, friends, or neighbors, because sometimes just one person knowing these 7 habits can be enough to save a life. Live healthy 365. Every healthy day is a day added to your life.